by EMS, most vehicles nowadays can do a 12-lead EKG in the field. So if they diagnose a STEMI, they'll call it a STEMI alert, as they say, which gives us in the emergency department a heads up, and we make plans by notifying the cath lab, the cardiologist, getting all the medications and drugs ready. Now if they walk in, we don't know, so that's why the guidelines are, the goal is to get the EKG done within 10 minutes of arrival. 10 minutes of arrival. So if a patient arrives with a known STEMI based on the EKG, the nurse or nursing team, usually it's more than one nurse, will come into the room. One will be designated putting IVs, usually 2 IVs, peripheral. Another one is placing the patient on the monitor on 2 liters of oxygen nasal cannula and on the oxygen saturation monitor or the pulse oximeter. Sometimes there's another nurse doing documentation, asking questions, entering all into the computer, the EMR, to register the patient and get that going. Usually there's another nurse, if notified by the doctor that it is a STEMI, calling the cardiologist, or if they have a cath lab, they're notifying the cath lab. So usually it's a team approach of a minimum of 2 to 3 nurses for STEMIs. The biomarker that's used the most today is the troponin. There's different ones, troponin I, troponin T. In our hospital we use troponin I. It usually elevates within 4 hours of pain onset and will stay elevated for several days. The troponin I is considered one of the most sensitive and specific biomarkers and has been recognized by the World Health Organization as a diagnostic measure of an acute MI. So the nurses, in discharging a patient of this nature, which has had a heart attack and just about every risk factor, so it would be a multi-pronged discussion and education about, for example, exercise and eating right for both the diabetes, the obesity, and the hypertension. So low salt, low fat. Watch the carbohydrates. There would be an emphasis on taking a statin. Statins have been shown to lower total cholesterol, so that would be part of the education. There probably would be a dietitian or nutritionist involved. The nurse would, for example, educate them about compliance with all the medications, especially the antihypertensives, the aspirin. Usually these patients go home on Plavix or aspirin daily. It depends if they've had stents. Some of them stay on, some of them are even put on some blood thinners. So she suffered severely because now she's pretty much what they call a cardiac cripple. You'll hear that term. What that means is because her ejection fraction is so low, this woman's quality of life is going to be dismal. She'll be tired and fatigued just walking around the house. She'll easily go into heart failure all the time and be short of breath. So here's a very dramatic example of a severe STEMI that she survived, but it impacts her the rest of her life negatively. I've had a few patients where I remember they were having an acute MI as I'm talking to them, and suddenly their eyes roll back, and I look at the monitor and they're in VFib, which gets my heart rate up. So I've had to do the precordial thump where you hit their chest real hard. In the 2 or 3 cases I've had, that did not work, and we've had to shock them, but in all of them we were able to bring them back, and we gave antiarrhythmics, and they were all taken to the cath lab successfully and survived.